Estamos ao vivo. Boa tarde a todos os presentes nessa live. Sejam todos muito bem-vindos e muito bem-vindas. Estamos aqui na nossa terceira live. Ontem nós tivemos a live de abertura do ENIP e hoje de manhã tivemos outra live sobre a economia e o enfrentamento da Covid na Espanha e no Brasil. Sejam todos e todas muito bem-vindos. Não esqueçam de curtir e compartilhar essa live com os seus parceiros de grupo de pesquisa para torná-la pública. Então, agora com vocês, a professora Elaine Espíndola.
Boa tarde, muito prazer em virtualmente vê-los aqui no quarto ENIP. É um prazer estar falando em nome da PRPG e da UFPB e estar conduzindo essa sessão com duas professoras renomadas, a professora Elizabeth Ryder e também a professora Ana Carla Vogelé. Eu vou fazer essa apresentação em inglês para que todos possam estar acompanhando, uma vez que a professora Elizabeth Ryder vem da Universidade de Harvard dos Estados Unidos. A professora Elizabeth Ryder é Director of the Boston Children's Hospital at the Harvard Medical School, the Faculty Fellowship in Humanism and Professionalism, and also Interprofessional Leadership. She's also a member of the Division of General Pediatrics at the Department of Pediatrics at the Boston Children's Hospital Department of Pediatrics at the Harvard Medical School. She's also a senior fellow of the Carlton Horvelt and a former Medicine Academy chair of the National Academies of Practice. She's the associate editor of the Patient and Education and Counseling journal. She's a founding member and a management committee of the International Consortium for Communication and Health. A professora Ana Carla Estelita Vogelé é graduada em fonoaudiologia, tem especialização em patologias da linguagem, mestrado em ciências da linguagem e doutorado em linguística. Ela tem estágio pós-doutoral em linguística em Amsterdã. Atualmente é professora adjunta do Departamento de Fonoaudiologia da Universidade Federal da Paraíba desde 2009. Ela tem experiência nas áreas de linguística, transtornos da fala, transtornos de linguagem, comorbidades do neurodesenvolvimento e transtornos mentais da infância. Ela tem certificação em educação parental pela Positive Discipline Association. Então, é uma honra, it's an honor to be here to present to you this mesa redonda virtual intitulada Mental Health in Time of Covid-19 Pandemic, Humanistic Values in Healthcare. So, I will ask Professor Ana Carla to start presenting, and then we'll go on into Professor Elizabeth. After that, we're going to open up for the Q&A session. So they will talk for around 20 to 30 minutes, and then after that, we will open up for Q&A. Right, Ana, could you please?
Yes, I'm sharing. Can everybody see? I'm sharing my presentation. I'm not sure if you can visualize that. It's okay?
Yes.
Can you see? Yes?
All good.
Good. Hi, everybody. Thank you for coming today. Everybody's here to be with us talking about such an amazing topic. I'm Ana Foglai, as I was introduced, and I'm looking forward to talking to you about communication and mental health in children in time of COVID pandemic. I would like to thank the invitation to be here. It's an honor for me to be in the presence of Professor Elizabeth to talk about this topic. Yes, I'm a speech therapist, a speech and language pathologist, but I'm also a parent educator. And I feel more comfortable to be introduced here, to introduce myself here also as a mom of two boys and we are also experiencing all this pandemic situation. So I would like to share with you that when I started to prepare for this talk, I was reminded of all the challenges my family has been experiencing. So it's not only a technical conversation, I hope. It's a pleasure to be here. So I'd like to talk to you about how can we protect the mental health of children through positive and more effective communication during COVID pandemic and beyond, of course. Um, so our children have witnessed rates of infection and death, restriction on their day-to-day life, and preoccupation of their parents and communities all the time about the implications of the pandemic. So while children are relatively unaffected by the virus directly, its psychological impact cannot be underestimated. Even the youngest children are aware of changes in adults' emotions or the absence of familiar caregiver. So it has a huge impact in the family life. We have been struggling with a lot of adjustments on account of social distancing and home confinement. Schools are closed, and children are spending all day long with their parents or other caregivers. And what could and can be wonderful, of course, but they have to work. They have some professional demands, and they are also struggling. So the COVID-19 pandemic has really challenged the way we live our lives. So parents are experiencing certain changes in their lives and routines. They are having to balance children being home full time alongside jobs, employment, and health worries, financial concerns, of course, and care for family members. Children, by the other side, have struggled with adjustments to their routines, schools and childcare closures, social distancing, home confinements, and for some families, home confinements, it's not only social distancing, but also nature distancing. And all these may interfere with their sense of structure, predictability, and security. And children typically possess less abilities than adults to decipher and to understand from the news the extent of risk that a disease outbreak poses to them. Even the vocabulary of our children are changing. We have 2 years old children that are learning how to say masks, how to say alcohol, or even the coronavirus or COVID are new words in their vocabulary. And of course, all this makes a lot of change for us. Adults' preoccupations with the financial, practical, and emotional impact of COVID-19 may compromise their ability to sensitively recognize and respond to signs of children's worries and distress. Of course, parents normally they have a lot of work, and they also have a lot of demands at home. And even in a standard situation, we have to be recognizing and responding to signs of our children. But in a pandemic scenario where we are all the time with our kids or the caregivers are with the children, they have to be even more sensitive to recognize and to respond to these signs. So how can children react to all these changes? Some children may be irritable or clingy, and some may regress, demand extra attention, or have difficulty with self-care, sleeping and eating. Some can have fears. So it's possible that children at home, some children that use it to brush the teeth or to take a shower alone, or may eating alone, they may need some extra help now. And you can say, oh, well, you used to do that by yourself. Why now you're asking me to do it with you? So we are all the time observing that children are having some regressions, and it's completely normal. And new and challenging behaviors are completely natural responses, and adults can help by showing empathy and patience. What is really difficult for us as an adult in this scenario, because we are all the time worried about a lot of things, not only the pandemic and financial situation and our professional demands. And all the time we have our brain is making some extra work to make us empathetic and patient with the children. And during times of stress and crisis, it's common for children to seek more attachment and be more demanding of parents. And we also have to think about that. So children that are vulnerable. I'm trying to talk here in general about children and families and how to be a positive parent and communicating better with my children. But of course, we have to think about that vulnerable children that, including all these challenges, they have also the challenge of not having food and of having been away from their parents and hospitalization or losing their parents. And these children, they still demand more empathy, patience, and more governmental politics. So the most common reactions are challenging behaviors, disrupted attachments, and disorganized interpersonal relations. And the parents or caregivers distress during disruptive and overwhelming community events is positively correlated with increases in younger children's mental health concerns. In a recent paper about behavioral and emotional disorders in children during the COVID still epidemic, when it was published in China, they could see that the most common behavioral and emotional features or disorders during the pandemic was clinging, inattention, irritability, worry, obsessive repressive updates, fear, sleeping disorders, poor appetite, fatigue, nightmares, discomfort, and agitation. And we have to handle with all that at home all the time because we don't have childcare or school available for that. Besides, critical resources are directed away from primary care to respond to the pandemic. So we have illness, hospitalization, separation, loss of caregivers, and these have an immediate harmful effects on young children's health, nutrition, well-being, and learning. These factors are compounding by stress experienced by the caregivers, undermining their ability to provide consistent nurturing care. Even those parents that have the optimal conditions to provide consistent nurturing care in such a situation, they have experienced some stress, they are struggling. And we have also the evidence that the rates of domestic violence and child maltreatment increase during community health emergencies and times of school closure, because people are really distressed and with a lot of demands, and children also demand more in such a situation. So even the most well-prepared parents, they are challenged to handle this disruptive behavior or challenging behavior. Even those parents that would say that never would hit or will never be violent with his child can experience a time in which you have that moment arriving. So we have evidence that this increases a lot in health emergencies. There is a technical note for protection of children during the coronavirus pandemic. I really liked the sociological impact in which they show the protective and the risk factors, in which we can observe that the child is involved in a family, in a community, and in a society reality. And of course, we are trying to develop creativity, resilience, personal safety plans, including safe adults, communication. We are planning family time and activities, in increasing time with parents, and okay, it's a protective factors. But also we have reduced access to social supports. We have also caregiver distress. We have an increased risk of violence. We have poverty, fears, and disease. We have mental illness. We have even the increase of substance use in the family scenario. So I really like the socio-ecological figure of protective and risk factors, because we can see that it's not only a child and a family problem, but also a community and a society problem, because we need to have resources. We need to have access for community supports, to healthcare, to education, to play. We need play space. We also need some formal support. We need food banks. We need virtual support. So, and we need to have essential services available through the government. And unfortunately, we have in this moment society, community, family, and child suffering, struggling all together. That's why we cannot just understand that our communication is just between family and child. So what can be our strategies? First, the first thing we need to remember is that children learn by modeling, and we have everybody struggling, distressed, with sad, with fears and loneliness. We have overwhelmed parents and caregivers, and not only physically, mentally. We have the home office demands. We have professional and personal life messing up. Our brain is always having extra works, and how to help children to cope if the adults don't have these skills. The most important and impactful form of communication to them is our own behavior. So the first thing we need to remember is that children learn by modeling. It's the first thing we have to do to communicate effectively with our children is monitoring and taking care of our own behavior. And I really like also this psychological phases of COVID and how to help children to cope with that. And thinking about now the current phase and the impact in which we have lots of emotional responses, and what we can do, we can limit news media, we can create structured routines, maintain sleeping, we have family meetings, we have how to connect with children, and it's about the impact in which the current phase in which we are starting to think about now. And a lot of families are living a real dilemma. We have the digital learning being proposed, so promising models in which we have media-based intervention. Amid these widespread stay-at-home directives, most settings serving children and family swiftly moved to implement some versions of technology-based remote service, and we have a lot of screen time. And of course, we think about this screen time is not helpful, but it's the media-based intervention we have now. At the same time, we need support, and we worry about this increased use of online platforms and the risk to the children to online threats, such as exposure to inappropriate content and exploitation, and concerns about moving educational service to online platforms without proper monitoring. And of course, children at risk academically could be further disadvantaged if they don't have parents who can support their learning process at home. And not all children can have their parents supporting. So what can we do? Well, the first thing is to try some effective and positive communication with children about COVID-19. And this can help to protect mental health. The Lancet Child and Adolescent Health highlighted specific developmental principles that should guide conversations with children about the COVID-19. So first, children need to have honest information about changes in their family. We need to consider the child's developmental stage. So if I have a child, a 2-year-old child at home, and I have a 5-year-old child at home, of course I need to communicate with them in a different way, using a different vocabulary, using different strategies. We can tell stories, we can show pictures, we can make some playful ways to explain the situation we are going through. Communication with young children should not just rely on simplifying language or concept, but take into account the comprehension of illness and causality. So what parents are having to learn now? To be creative, we need cognitive flexibility, empathy. We need to take some decisions about temporary and durable solutions. Sometimes we are worried all day long, but we have to have our worst time apart. In the moments I'm playing with my kids, for example, I need to encourage the child to practice sitting with and experiencing the anxiety rather than doing something to distract from it. Of course, I'm not talking about babies. Of course, that we when we are with babies, we are trying to relieve and distract to make all life is beautiful. But of course, we need to remember that children are all the time recognizing, and they are attempting to our signs and our worries. And we need to help our child to notice and verbalize the experience of anxiety rather than avoiding. We need to try to normalize the experience of anxiety. And one way we have to do that is to say, I can see that you are worried. I can see that you are anxious. I can see, I perceive you're nervous. I'm feeling that too. And it's really difficult to handle that. I'm struggling too. And maybe what are you feeling is anxiety. Let's put our hand in our heart and let's listen how it's beating. It's beating fast, and we are feeling distressed, right? I'm feeling that too. What can we do together? It's a good way. So we need to encourage families to ground their communication with children on key values, to be honest and truthful, to have self-compassion, to talk about safety, to be sensitive, to have sensitivity, connection. So if the child is talking to me and I say, oh yeah, I see, and I am on my phone and not giving attention, I'm not connecting, it's not effective. It's sometimes even when I'm in silence, but just connected with the child is more, it's more effective than talking and talking and talking and talking to her without any connection. So, and also community building, recognition of death as a part of the life cycle and legacy. It's a lot of children are asking about death, and some parents really don't know how to handle that. I am talking that as a parent to my 5-year-old boy, have been asking a lot about what happens to me if I die. What happens to you if you die? What happens to me if you die? So where are we going when we die? And most of the time I try to ask, what do you think is going to happen? And I can say that we are going to heaven if it's what I believe in. But if it's not what I believe in, I have to be honest, and I say, I don't know what is happening to you if you die, but I know that what is going to happen to me, and I will feel very lonely and sad, but it's not going to happen. I need to reassure all the time that it's going to be okay. Everything is going to be all right. So to make a proper and structured routine activities together, and when I say together, it's not only we are in the same place, but we are together. Connection is the word. Reassure that this will pass and we are there for the child, provide age-appropriate information. I will not explain what is a virus to a 2-year-old boy, but maybe I can explain that for a 5-year-old boy. It's okay not answer everything. It can be an opportunity to find out information together. So sometimes a child can answer a question that you're not able to answer, and say, let's find out together. I will search for that. And be careful for not sharing too much information at once. So you can explain in parts what we have in a virus and what is going to happen. And after you can explain that the grandpa and grandma, they need to be even more isolated because the virus, they are more dangerous to that age, that people in that age. So, but in peace, it's not at once. And it's important to have also some shared routine at home, not providing everything ready for children. So kids can help at home and they can learn with them. So now we are all together at home. So you will be responsible to put the dishes on the table. You will clean up the bedroom after playing, and I'm going to be responsible for the garbage and to share. We can also try to practice some mindfulness together, yoga, gardening. We can have family meetings. We can have move time together, playing together. When I'm saying playing, it's anything that we really can. It's obvious. Of course, we have to play together, but there are some parents that before the pandemic situation, they didn't know how to play with their children. And now they are learning how to play with them. Other things is very important is ask for help. And it's important children watch adults asking for help when struggling, so they can see everybody need to do that. Everybody do that, so they can do that. It's I brought here some things that I'm doing at home during the pandemic. I did with my husband and some. It's in Portuguese. I'm sorry for Professor Elizabeth here, but we tried to categorize our emotions in 4 colors: yellow, pink, blue, and red. And that we have angry and tension, and I need attention. I'm I want revenge, or I feel totally unacceptable in that moment. And we made a thermometer of emotions, and we made some pictures we used from the positive discipline association chart of feelings. And sometimes, and this is fixed in the door of the bedroom. And sometimes when we have some challenging behavior, we go there and say, how are you feeling here? Point here to me. How do you feel now? Oh, it's that. Are you feeling angry? Are you feeling tired? And also I have my tips and my guide in the other side to help me how to be effective. And I have some ready phrases, because in that moment I need that. And also we have some wheel of choices, and there are things that we are building together, and it can help, of course. Also, social distance should not be the same as social isolation. We can make plans together for the pandemic situation, and we can make plans together for beyond, after the pandemic. We can make some we can have some papers in which we draw what I want to do together when with my family or with my friends when all things pass. I would like, and we can draw that together and put in a box, and we can open when everything passes. We can practice self-care, and it's a really difficult situation for parents because they don't have time for that. Feelings validation. So if my child is feeling angry or is feeling sad, I cannot say, don't feel sad or don't feel angry, but I know you feel sad. I can see you're angry. I can see you're distressed. And it's okay to feel like that. What can we do to help with that? And the child is the child doesn't have any reason to deny her feelings and emotions, but ask for help how to handle that. And increase children's self-efficacy. Self-efficacy is the sense of having agents or control, an especially important trait during times of fear and uncertainty. So what can we do to help? They need to maybe they need to know they are useful and important, and that they are growing up and being better person in all that situation. So if I could summarize, what can we do to be effective communication with our children in the pandemic situation and beyond? I would say that, remember, children want to be useful, important, and want to be accepted. And validating and being positive and being empathetic and saying that you feel the same. And what can we do together? I'm feeling really stressful now. I'm going to count to 10. Can you do that with me? Can you give me your hand? Can you hold my hand and help with me to breathe together, to find my control and to find my self-regulation? You can do that with a child. That is not a weakness feature. It's to be together. It's to be beside the children. It's to be with the child. So be positive and encourage and praise. And it's to say, it's to communicate the children that we are raising, we are developing together, and to be very proud of the littlest step we can do together. We should not be perfect, and we are not. We don't have to handle with everything perfectly, but we need to be together, validating and naming the emotions and searching for ways to handle these emotions. And labeling is the first step. Validating is the second step. And being together to find solution is the third one. So I think that we can do a good job. And I think that this can be effective for positive parenting and active parenting post-pandemic. I think so. I'd like to thank for attention, and I hope to have been helpful for you.
Anna, for sure you have been very helpful. I was really looking forward for your talk, and I would like to compliment you on your talk. A very relevant topic of research, really needed as life has changed abruptly, and even if we plan the next days, we're not sure of the future. So to me, it is relevant to look at the evidences we have today to understand the best practices for giving support in terms of humanistic values in the context of healthcare. And in this same line of thought, I would like to invite Professor Dr. Elizabeth Ann Ryder to talk to us about how to attend to values in the time of COVID-19, the International Charter for Human Values in Healthcare. I'll ask you for 1 second because I'm going to be the technician of this, trying to present her slides. Is it good? Can you see it? I cannot hear you.
Microphone is muted.
When I blow it, yes. Can you all see it?
Yes.
Okay, I'll do that now then.
Perfect. Okay, that's great. Thank you very much. There are always technology challenges in addition to pandemic challenges in our virtual world right now. But I want to thank you. I am very honored to be here. I want to thank Professora Espindola for inviting me, and also Professora Anna Vogeli. That was a wonderful presentation. And I'm a pediatrician, so I really found it very helpful and very useful for all the parents who are now home with their children and didn't expect to be. So you can go to the next slide. So we're going to talk about, this is the roadmap for what I'm going to talk about today. So we'll talk about some of COVID's challenges to humanistic healthcare. We'll talk about values in healthcare. This can be a foundation for what we do because there's really no guidance. We're in a very new situation with this pandemic for most of us. And then I'm going to share with you about the International Charter for Human Values in Healthcare. And it's a framework that we use for teaching, for practice, for life, for all human beings. So the next one. So COVID-19, what is COVID-19? It's the disease. It's a coronavirus disease, 2019, because that's when it was first identified. And it's called by a virus called the SARS-CoV-2 2019 nCoV. And that's a new virus. Sometimes you'll hear it called a novel virus, which means new, a new strain of coronavirus. So next. So where are we now in this pandemic? There have been over 39 million, almost 40 million confirmed cases. These are laboratory confirmed cases worldwide. There have been over 1 million deaths, and this virus is in 235 countries. We can go to the next one. So I thought I'd just show these interesting statistics that the United States and Brazil are quite challenged. We are the first and third in the world in the number of COVID-19 cases. As you can see there, India is the second one. So school, and you go the next. And so school closings, this has affected our children, as we just heard about, in 193 countries. This was in April. Some of the kids are at school. We'll see how long that will last. Many of them are not, but they're being schooled at home as best we can do. And so 193 countries, and that affected over 90% of all the children that are enrolled learners that would be in school in the world. So that's more than 1.5 billion children. So we can go to the next one. So we have many, many challenges. There's the mental health challenges. There's lockdown, quarantine, social isolation. There's education loss of missing out. They found kids even in the summer can lose some. And then there's the inequities there. There's poverty, food insecurity, housing insecurity. As Anna had mentioned, domestic violence, there's child abuse and neglect, increased from normal. There's large economic issues and loss of incomes and jobs. There's racism, disparities in care. So there's a lot of challenges out there right now with the pandemic. And next one. So there are ethical challenges. So there's a risk of moral distress. So in addition to the physical, the social, and the economic challenges, there's moral distress. So moral distress is when you know the right action to take. Like, I need to put this patient on a respirator, or I need, I know this is the right thing to do, but you can't because there aren't the resources available. Or you may conflicted about, well, what is the right? You want to go back one? There you go. Thank you. Or conflicted about what course of action is right. So when you're in a prolonged, morally distressing situation, as in the pandemic, it's cumulative, keep going on, then moral injury can occur. And that's when you get compassion fatigue, you get burnout. And I'm talking mostly about healthcare workers, clinicians that are on the front lines, and they also can get post-traumatic stress syndrome. So next one. So there's resource challenges. You've probably heard a little bit about rationing, which I won't go into in any detail, but in most countries, there are shortages of adequate resources. There's not enough intensive care unit beds or ventilators or what we call PPE, personal protective equipment, masks, gowns, gloves, face masks. There's not enough medication. There's medication shortages. And then there's not enough healthcare professionals, physicians, nurses, respiratory therapists, lab personnel. A lot of them are out on quarantine or isolation because they've tested positive or they've been exposed. So it's so many challenges that are leading to dilemmas regarding how do you allocate these resources. Go to the next one. So, go back. There you go. So basically, this is to say, where are we now? What are we dealing with? We have all of these challenges and many ethical challenges. So you can go to the next one. So I want you to think for a moment. If you have a piece of paper, you can jot this down, write this down, or just think in your mind. So if you think about your experiences in healthcare, all of our audiences, and your experiences as a patient, or your experiences as a human being, what core human values do you think should be in every healthcare interaction? And those interactions would be patient or clinician, patient, with colleagues, with your learners, if you're teaching students. So just have you think for a minute here to think, what values do you think are the most important for every healthcare interaction? Okay. So we'll go to the next slide. So as a background, I'll tell you, healthcare is relational. It's relationship centered. You are in relationships. Physician, patient, clinician, patient, teacher, learner, colleague. And interprofessional collaboration is relational, clinical practice is relational, and attention to core values made visible by skilled communication in all relationships is necessary for safe, compassionate healthcare. This is particularly important in the time of, it's always important, but in this time of COVID-19, where there's limited communication, it's very hard to communicate with patients and families because you have masks and gowns and isolation. They can only see your eyes. And particularly with children, they learn by facial expressions, and they don't see the bottom half. And that is very difficult, but it's necessary for safety. Family access. We've been working with some teaching physicians who need to talk to families who have a family member dying in the intensive care unit, but the family can't go in and be with their family person can't go in and be with the patient because of COVID. And there's a lot of healthcare worker fatigue and stress. Let's go to the next one. So I'm going to tell you about the International Charter for Human Values in Healthcare. This is potentially a framework for solution. So this idea came out of our first international roundtable in healthcare in Hong Kong in 2011. And this charter that I'll tell you a little more about represents an interprofessional collaboration to restore the primacy, the most important centralness of values that are necessary to practice compassionate, ethical, and safe healthcare. And so this is the goal of this, and you can go to the next one. Elaine will remember this picture. This is our room that we presented in. So clinicians, educators, linguists, researchers, healthcare leaders, initially we identified values, and then additional data was collected from multiple groups and forums around the world. So we asked the same question that I just asked you, drawing on your professional experiences or any experiences and your experiences as a patient, what are the core human values that should be in every healthcare interaction? We'll go to the next slide. So this was a 3-year process to identify and develop a framework of values that we used to combine qualitative research methods. We had expert focus groups, content analyses, iterative consensus, Delphi methodology. Notice all these qualitative methods, focus groups of the Harvard Macy Institute for faculty and scholars, and expert consensus. So we put this together from people around the world. This was different than a committee deciding what a charter would be, but this was really taking input of many people and groups, including caregivers, families, patients. And we will give you the link to, there's a open access paper for those who want to know more about the specific research details. So I'll have you go to the next slide. So what did we come up with? Well, we found 5 categories of values. Sometimes I call them buckets of values. So compassion, respect for people, for persons, a commitment to integrity and ethical practice in your relationships with everyone, commitment to excellence, and justice in healthcare. So these were the 5 categories. And then I'll have you go to the next slide. This is an example of subvalues. So within each subvalue, there are more specific values, subvalues that belong in there. And all of these are in the paper that you can download, the entire charter, and all of these are in there. So if we think of compassion, this was the most of the other categories had about 5 values, but you think of what is compassion? It's caring, it's empathy, it's motivation to help and heal, it's kindness, generosity, genuineness, curiosity. You want to know about your patient, altruism, mindfulness, being present. So that's one example of some of the subvalues. For the other 4 categories of the charter, there are also subvalues. So here you go to the next slide. And there is a handout. This is the article, and we'll give you the link to that will explain all this in great detail, including the research methodology. You can go to the next slide. So we have this is tough. So how do we find our path in this very challenging time? How do we find it? And so basically, this is a time of limited communication, particularly for healthcare workers with their patients. There's fatigue and stress. There's clinician distress just in this environment.
Eu acho que travou, mas deve estar voltando já já. Okay, good.
I'm sorry. I don't know. We're communicating from a long way. So this, I've worked for our institute for a long time, and this is, here's someone on a tightrope. This picture sort of tells us we don't know where we're going. We are holding ourselves up. We are finding a path through this very challenging pandemic. So you can go to the next slide. So how do we handle this? Well, we come back to our values. And so we remember what those values are. If we have our values, our authentic selves, our moral capacities, this will help us. And in this country, we might say when you're in the deep weeds with a patient, a clinical situation, a family member, that means when you're in a very challenging, difficult conversation, and there are impossible decisions to make. For example, do I remove the ventilator from this patient in the ICU because we don't think there's any hope? Or do we keep it on longer, or do we do another thing? So these are impossible questions, but you can always go back to your values. They won't give you the exact answer, but you can say, is what I'm thinking about or planning compassionate? Does it respect the patient? Does it respect the patient's dignity? Is it just? Is it healthcare justice? Is it excellence, meaning is it the best I can do? Is it does it have honesty, integrity, ethical practice? So we can always come back to our values. And when we're communicating with patients behind the mask, behind the face shield, where we can hardly see them, we're muffled, we can show our care. We communicate our values by demonstrating them. So we can show our care. And I think that we can't cure this COVID yet, but we can be present, especially when patients are isolated and vulnerable. We can be present. We can be present with the family. So this is something that our values can help us greatly. It sounds simple, but it really does work when you're in those difficult situations. So you can go to the next one. So we use the International Charter to identify and promote core values, to provide a framework for education and practice, and we're using it in our curriculum, in our faculty development courses, our clinical training program, different clinical training programs internationally. And there are many frameworks. There's not a right value or wrong value, but what we found around the world is that the values fell into those 5 categories that I mentioned before. And interestingly enough, it was the same in every country. We looked in Asia, we looked in Australia, in Europe, in Canada, in the US, and the same values. They might rank them or prioritize them in a different order. Maybe excellence would be higher than another one in different countries, but they were the same buckets, the same categories, which was really interesting to me. And I mentioned that in one course I teach, and somebody said, well, of course, we're all human beings around the world. So I think that's really important. So if you go to the next one, and this is just a quick way of seeing. So as I had said before, we use the charter to identify core values in interactions. It provides a framework for teaching, for promoting attention to values. We enhance humanistic care by explicitly teaching those values. Sometimes I do workshops on how you teach them and the different methodologies that we're using. And it's very important to teach them and expect them. If you think of your children, if you expect them not to run across the street without holding your hand. But if you never tell them, they don't know that. So you need to say that. Oh, well, we hold hands when we cross the street. This is particularly young children. And then relationships and skilled communication. You can have your values, but you have to communicate it skillfully, verbally, non-verbally. And by having skilled communication, we can demonstrate our values, demonstrate our respect, demonstrate our compassion, and those sorts of things. And I'll have you go to the next one. And I teach faculty because we have to start at the top. So if you teach your faculty to be humanistic and pay attention to values, then they can indeed then they'll teach the students and the trainees, the residents. And so one of the faculty that I teach is one of our fellows said, our values are like roots. They hold us upright when they are present, and they can cause us to fall when they're absent or decay. So that sort of shows the importance of the values. And then you can go to the next one. So how do we promote ethical, relationship-centered, values-focused healthcare? It's really all about relationships. Go to the next one. And the core values that guide and inform those relationships. You can go to the next one. So you must be the change you want to see in the world. And then I'll have you go to and then this is the last slide. There you go. So I hope I got that word right. It was an A or no, but so thank you very much. I'm delighted to be able to talk about this, to be able to share it around the world, and they can let you know how to get a copy of the paper, the link.
Well, Professor Beth, you have all the way gone from Hong Kong now to Brazil, so I think it will be traveling more and more the world. So I want to say many thanks for such enlightening talk. For me as a linguist, it's of utmost importance to understand what goes on behind the scenes and realize that core values are present in every healthcare interaction. This roundtable has shown through your research the relevance of interprofessional, international collaboration aiming at restoring the primary of human values necessary for practicing compassionate, ethical, and safe healthcare. So I will open up for questions, and then we can go on discussing what was not said in the slides. But I want to congratulate and compliment both of you. Emerson, Emerson, você quer que eu te ajude na escolha das perguntas? Okay. Anna, this question is for you. And this is somebody I kind of know all the way from the south of Brazil, my cousin, and he says, Ana Magalhães, do you understand that children will have a negative long-term impact due to this moment when relations were practically restricted to contact with their families?
Yes, well, they are going to have a long-term impact. That's what I think is totally predictable. If it's a negative or a positive impact, of course we are going to have some negative impact, but it can also have some positive impact. Some children can have some benefits for having spent more time with their parents if their parents could support them effectively. But of course, that's not a typical scenario. Of course, we have vulnerable families and vulnerable children to think about, and if they are going to have a negative or positive impact, it depends of the relationship they build in this moment. Of course, they are going to have an impact, long-term impact, but I don't think that it has always to be negative. I think that we can have some negative aspects and positive aspects depending on their families' interactions. And of course, we can have more negative impacts in their families in which their kids didn't have the proper support of their families, or if they lost some parents, if they could see people dying or suffering. Of course, this can be traumatic, and not only long-term, but medium-term even we can think about. But I cannot say that always, of course, it's going to be a negative long-term. It's what we are talking about. For example, I can think that learning, some child that is learning literacy, the child was learning how to write her name, for example. Well, she can have a delay, but it's not a negative impact, long-term impact, but it's an impact. But some some child that lost a parent, lost a grandma, grandpa, a friend, it's a negative impact. It depends on what happened and the support the family could provide. I think we have to research and discover what are the factors, the risk and the protective factors that finally could interfere in the impact.
Professor Anna, very, very important to mention that we have both sides always, right? And it was something so abrupt that we had to hide ourselves inside our homes. And we, in fact, do not know what are the impacts that this will implicate will have in the future, but how we're handling with this at the time being. You mentioned kids being learning to read and write, right? Their literacy times. I have a 6-year-old at home, and because I was able to, I have a fortunate way of settling up my time. I could stay with her every morning, and she did learn to read, write, and decipher the codes. It's not only, so it depends, I think it depends, and for this I mean it's just thinking, but it depends on the situation of every household, and I think this will have impacts and implications for the future for sure. These kids, they're and I double quote here, losing time with other kids, so social time, that it might be really, really important. But I think it's just thinking, right? This is just me looking at what I have on a daily basis. So I think your research is really, really, really fundamental for now and beyond COVID times. Many thanks. I will pass on to the other one. Emerson, eu consigo pegar daqui, tá? Então tu não precisa se preocupar, eu tô nos comentários. There is a question from Marcele Alves. She has 1 out of 3. So I'll go to hers and then I'll go to the others. So Marcele says, Anna, it's difficult for adults to model behavior because this situation is completely unexpected. So many adults don't even know how to deal with the uncertainty themselves. Then she goes on. You've mentioned children presenting regressive behavior. How can we model or provide an environment besides empathy and patience to keep their independence growing? Can I continue and then you answer all of them too? And then she says, and also, do you think this regressive behavior is just a coping temporary mechanism, or this may be a long-term thing?
Okay, let me try to answer, or maybe to even question also. Well, I think that it's true. It's difficult to adults modeling behavior if we are not prepared for being that model. We have to learn in few days how to be suddenly a model. Of course, it's not only a pandemic problem. It has been since our existence to be a model. Our behavior, they are modeling, they are copying. So, well, you asked it, how can we model or provide an environment besides empathy and patience to keep their independence growing? The first thing we have to do is to control ourselves. So I will give an example. I like to answer with examples because they can be useful when you are a parent, because I think that there is some parenting concern about that. So I'm during the COVID pandemic and taking a shower, and my youngest 2 years old, before being 2 years old, broke the glass of the bathroom, and I was totally cut and bleeding. And my oldest boy was in front of the bathroom, seeing all the blood, and he looked at me, and I could connect to him without saying any word. Of course, I'm screaming, help! And everybody was to the bathroom, and my oldest one looked at me and said, breathe, smell a flower and blow a candle. Smell a flower, and blow a candle. And I just did what he said to me, and I could see that my youngest one was not who was bleeding, but myself. And I said, oh, it's okay. It's okay. I can handle that. And okay, it's okay. And after that, I had to praise him and said, I really want to thank you because you reminded me to breathe and to be calm. And it was really difficult to me being calm that moment. And for you, it was better because you were not during the scene, but you was seeing. And I could see that you've learned. We can learn together, and we use that opportunity windows to make ourselves better and to learn with that things we taught our kids. Sometimes we have to teach things that we don't know how to do. But in my environment, in my family environment, you know what I did? I did some. I made some some sentences reading. Remember to breathe. Remember to say you don't know. Remember to say you need help. Remember to say you're not good to talk in that moment because you are also angry and you ask some minutes to go to take some fresh air and to continue talking. Remember to be eye with eye, face to face, and not talking to your kids when you are standing up and here is asymmetric, but you have to be face to face. So we put reading remindings in the wall. Of course, during the pandemic, we could throw them away because we have already memorized it, but we needed that. And it's fantastic to see that even then, my oldest one drawed something and, can you fix, Mom, in the wall? I said, what is that? It's a remind to me, because when I'm angry with my little brother, it's for me to remind not to throwing the toy on him, to control myself. It's written there. Oh, really? It's written there. Oh, fantastic. Congratulations, I will do that. Because he could see that I was using that, because I'm not perfect, I'm human. And it's a value for our family to keep us together and not hurting or not breaking, and to respect our house and our family. So one way we found to model and to provide this environment and to keep their independence growing was to make ourselves better. I came back to therapy. Of course, we needed some help too. I had to say no for some invitations, so for some professional demands. I had to say no. Of course, my husband had to say no. Of course, to me, sometimes it's easier than for him, because my husband is a psychiatrist, and we have increased the number of suicide here. And of course, he can say no. No, I can say no because I'm a professor, and he's in a intensive unit, COVID. And he cannot say no, and I have to support him too. So as a family, we have to discover what we can do, because I cannot take to my account what I cannot do. But one thing I can do is to try to model, is try to control my own behavior, to regulate myself, and even to say I failed when I failed. I'm sorry, I screamed to you that moment. I was really distressed at that moment, and I've screamed with you. I'm so sorry, darling, I did that to you. I will try not doing that again. So it's the honest. I think it's for them. It's a kind of it's truthful. I can trust my parents because they are being honest. They are trying to be honest with me. And the last one. I'm sorry, I have to see the last one. Here.
I can repeat.
The regressive behavior is all the times children have regressive behavior. When the youngest boy was born, they have regressive behavior. When you change the school, some regressive behavior, they appear all the time. So it's a temporary mechanism, of course, but of course he can have other social challenge in the future, and some regressive behavior can appear again. But all the regressive behavior, they have to be temporary, because to be natural, they have to be temporary. If they are permanent, or it's not so natural, let's take care of that. I hope I have answered, but I think I have also that question to me too.
Yeah, it's something that has caught us, right? So we try to, but I think you were directed at her question. Marcel is actually a advisee of mine. We're working on a project that we're looking at therapeutic discourse during pandemic times. So another question is for Professor Ryder. And he says, it's Eric Marinho, and he says, in your opinion, Professor Elizabeth, what's the role of linguistic studies for the context of COVID-19 healthcare that we are living in? Just your mic.
How's that?
Good.
So, what is the role of linguistic studies for
the role of linguistic studies for the context of COVID-19 healthcare that we're living in?
Okay. Yeah, I think that's a very good question. And linguistic studies is very important. One of the things that we've been working on since 2011 and that this charter came out of is our work together. You know, I'm a physician and a pediatrician and a clinician and also an educator, but we have many linguists that we're working with. And so I think it's very important to have to work together. Like there's a statement of all of us in a group is smarter than one of us. So I can do studies, but I don't have all the skills or the knowledge that linguists have, and vice versa. And so we have found by having we call it interprofessional, interdisciplinary, multidisciplinary group that we work with internationally, that we can learn a lot more. I mean, for example, a linguist may be able to look at the corpus, I'm not sure I have this right, but look at what the words mean, what are the frequency of words. They can analyze, what does compassion mean? I can tell you what I think it means, but from a linguistic standpoint, linguists can look at it in much more depth in terms of what that language and what that context means. So I think working together, there are extremely important that we do work together. That's what we're doing. We have an international consortium for communication and healthcare that is now a group of universities. We started out with ultimately 100 people from 21 countries from 2011 till now, and it's morphed into, we're still working together. There's 4 of us still working together. And we'll continue to do that. And it's mostly linguists, actually. And I think it's extremely important. So good question. We need each other.
We need to collaborate, right?
Collaborate, absolutely.
Another question to Dr. Elizabeth Ryder. It's a fair distribution on health, a suitable objective to core values. And what kind of equalities and inequalities might achieve such a fair distribution entails?
So let me see if I understand the question. So I'm wondering, they're saying, how do you achieve a fair distribution with the inequalities that are there?
Yes.
And with the values. So the values are sort of the fundamental bottom part. Like if we're making decisions, if we're a committee that's making a decision about, and I don't like this word, rationing. We don't have enough ICU beds, intensive care unit beds. We don't have enough respirators, ventilators. How do we make decisions? Well, I think at the first part is to always remember is what we're deciding, is what guidelines we're developing. Are they compassionate? Are they respectful? Do they honor the integrity of the patient, of the family? So all of those, are they just? Is this healthcare justice? Is it the best we can do? Is it excellence? So that's sort of the bottom foundation. But the next thing is, I think almost all countries are really struggling with how do you handle the resources we do have? It used to be individuals had the right to everything, and now it's like, okay, we only have so many beds. What do we do? And in this country, there are no general guidelines, but many committees and states have developed guidelines, and it's based on how well they think a person, what are the risk factors? What are the chances that they can survive? What are the chances they can survive in a reasonable way without chronic, everybody's got long COVID, the chronic pieces, but that sort of thing. What they're doing in one healthcare system here that I'm familiar with is that a committee will decide about a certain hospital and will decide about the intensive care unit and what maybe even individual things. They haven't had to do this yet. This is the good news. But they're ready if they have to. But that committee, which is interprofessional and obviously has physicians on it, they are not at all involved in the patient care. They do not work in the intensive care unit that's, that they're making a decision about, so that they are hopefully fair and impartial. So that's the first piece of how do you have that fair distribution. That is a question we're all asking, and it's really a hard one. And how do we do that, and how do we be fair? And I think it involves everybody. It involves the community. It involves governments to put together to make more protective equipment, to find respirators. I know that in Boston, I'm at Boston Children's, and there are many teaching hospitals and regular hospitals here. And what they did is some of the big hospitals that had a pediatric unit, they shut down their pediatric unit and made it for adults. So the adults got to go onto the pediatric floor and see all the cute pictures and all that, but they were treated there, and then all the other kids in the city and in the whole area went to Children's, who handled all the children. And then once there was time, once that the surge went down, then they, opened up their units to kids again. So, and I know that another hospital was short respirators, so our hospital sent them some because we had some. So there's really working together as a healthcare system to share those limited resources.
Excellent. We have another one that resembles a question already made, but then the question goes, Professor Elizabeth, you've worked with people from many different areas. How can we propose a more efficient cooperation between different fields regarding the pandemic? And then she says, I'm a linguist student.
So how to propose more efficient, I'm sorry, tell me again, collaboration between different fields?
How, you've worked with people from many different areas. How can we propose a more efficient cooperation between different fields regarding the pandemic? And she's a linguistic student.
Okay. Now that is what we have. I think it's helpful. That's a good question. I think it's helpful to have groups that do that, like our consortium is already set up, but we set it up ourselves. So we set it up with linguists, with physicians, with healthcare policy people, the whole thing, with healthcare leaders, with academics. And so that's one thing. What we have in this country is called the National Academies of Practice, and we have 14 healthcare academies, including speech, dentistry, psychology, social work, medicine. I can't even think of them all. What are they? Physical therapy, occupational therapy. And so each academy is a group of people. They can have like up to 100 in that field. And then we meet every year. We have forums, we have all sorts of ongoing things. This is a national organization in this country. So we are working on how do you do interprofessional, we call it interprofessional healthcare, across those fields. And I think part of it, like linguistics, from my understanding, is very broad. And we only work with the people that are obviously doing healthcare or related things, which also includes how you communicate with the public about washing their hands and wearing a mask. So it's a broad thing. But so I think just starting to work with people, like if you have a project, have someone in different fields on it. I mean, it can be done at the grassroots level. It can be done at a group level, like a university. We're having a lot of things trying to put students here through, how do you mix, let's say, nursing students and medical students together or social work students together for a certain class or a certain set of classes. So you can start to mix these things. It will take some time, but you can do it individually. You can have an advisor on a project you're doing. There's several advisors, that's even better. Lots of mentors, and have them linguistics, healthcare people, other things. Yeah. Very possible. You just sort of go out there and be a pioneer and do it.
One thing that we find a bit difficult is because there is a paradigm, and that is people see linguists, and this is what we're facing now, as people who correct texts and correct what is said, and so we are facing this from a linguistics background, but we've been opening up, and we have been finding people who have gone through linguistics who are from healthcare systems or healthcare areas, like Professor Anna here. Mm-hmm. She comes from a field that is from the healthcare, and now she has a PhD in linguistics, and now she's applying that to her area. So we have physiotherapists or counselors who have done a PhD in linguistics, and then we can start collaborating. I think it's always a kickstart, and I was really, really looking to this talk because I think we need to start opening up and stop seeing linguistics as those people, or linguists as those people who correct texts, who write correct. Or if you say, I'm studying to be an English teacher, and they say, how do you say that in English? Yeah. So it's kind of a view, a mistaken view, I would say, that I think once we start crawling in the area, in the scenario, in the national scenario, that will just grow, and collaborations like this, they're very, very fruitful, as I see.
Yes, it's like Anna said, we're role models. We are role models. We're working across disciplines. We're working with other disciplines. And I would say, be an ambassador, go out and do it. And then like presenting it here, you're hearing a lot about how we all need each other. Think of that comment we used to say all the time of all of us is smarter than one of us.
Yes.
We do so much more together, and to keep correcting that. I mean, I heard that the other night about, as universities contract and people are thinking, I think jobs are, the world is changing, but I think it's absolutely essential, and that we work together and sort of market it in a way, like, here we are, this is what we're doing.
Yeah, so we have many comments here, people congratulating you. Paulo Palhana, I'm going to read it in Portuguese, Dr. Elizabeth. He says, parabéns à doutora Elaine Espíndola, bem como a doutora Elizabeth Ryder e Ana Vogeley, pela rica conferência. And then Marceli goes on to say, congratulations, both professors, for the amazing talks, really enlightening and an essential discussion. It's a pleasure to interact with you. This is interesting. We think that only adults can teach kids. That's back to your question, Anna. But in times like this, we see very clearly that we also have a lot to learn from them.
Oh, definitely.
And then Jacqueline says, congratulations to all the professors for the nice conference, showing us how to confront or face COVID. Yeah. And then Edmilson Barborema, he's a professor at the department I work with, Department of Foreign and Modern Languages. He says both Brazil and the US have experienced polarized political views. And these have orbited the educational realm. How can we bypass this in order to promote mental health within our community? For both of you, there's no aim at one or other. I think both of you can contribute to this one.
So that Brazil and the US have experienced polarized political views. Yes, I would agree with that. And I don't know what the solution is. It's just astounding to me how the dichotomy, I mean, it's like it's black and white. It's like you think one side or the other, and we're not listening to each other. And part of what I think I rely on is that we need to understand the other person's perspective. It's not like, oh, you're a Republican or a Democrat, or oh, you're a doctor or a nurse. I don't like that. It's my implicit bias. And then all that piece, my unconscious bias. And so self-awareness helps, reflection helps. And I think, but I don't have a solution for this politics. I think we really need to learn to talk to each other, to understand their perspectives. I try to teach people that if you're talking with somebody and you don't agree with what they're saying, listen to them. You might learn something. They have a different perspective. It doesn't mean you're agreeing with them if you're listening, but you have to be civil, to have manners. I mean, there's all sorts of levels of this. In terms of our country, I don't know. But Anna, what do you think?
Well, I would like to know how to answer that even to my life. But but as taking the question, how can we bypass in order to promote mental health? The first thing we have to do is to think about our microsystem. Like, it's me, it's my family, it's my neighbor, it's my next community. My neighbors, my parents, my brother, or my close friends. But the first thing we have to do as a family is the self-care. Mm-hmm. So if we are having this polarized moment, and I know that discussion is not going to be a solution, and it's not going to change why I'm going to be there.
Right.
So even to protect ourselves to what is anxiogenic and what can be harmful for me and to my family, and of course, we have to have a boundary to protect ourselves. Yes. And to know that we are not going to change the world without changing ourselves, without taking care of the family, my neighbor, my community.
Yes.
It has to be what I can do. I cannot go there and change everybody. I would like to have that power, but I don't. We have just to protect ourselves and to take care of who we are together.
I think that's a really good point. And to protect ourselves, to set that, and then what you had mentioned earlier, Anna, about media. Limiting the media, putting boundaries on that. It is very harmful to children to watch in it. I mean, frankly, they're seeing horrible things. They're seeing bodies. They're seeing alarm, terrible things. And that is not good for them. They can't sort it out like we can. We can say, oh, that's not what I agree with, or that's something that doesn't make sense to me. But kids can't do that. And even with teenagers, you can talk to them. I mean, if they're insisting, you can sit there with them and deconstruct it with them, debrief it with them. Gee, this person's saying this isn't what's happening or not happening. Because I think the media just stirs up everything too. But I absolutely agree with Anna, is doing it in your own microsystem, in your family, in your community. And then we can work together internationally like this. This is good stuff. This is
excellent.
Yeah.
I could quote the charter here and say that we might look at compassionate, ethical, and safe political practices.
Yes. Yes. When we first did the charter, we were thinking, okay, this should apply to the stakeholders. This should apply to the companies that do the funding.
Yeah.
party payers. It's because it should apply to all human beings. I think that's an excellent idea. Yeah.
That's excellent. Well, it's time that we don't like, because it was really, really, really amazing. But we have other roundtables coming up. And Dr. Elizabeth, I hope this was the first time you were in Brazil.
It was. I've been everywhere, but I would have loved to have come.
No, we're walking through with Professor Diana Slade. We're working through our collaboration in the consortium, and now with Professor Anna here, and we also have another professor from speech therapy that we're gonna put something out, and we will surely collaborate in the near future. So many thanks again to both of you for your humanistic views and the values of healthcare in times of COVID and beyond. Thank you so much for everybody that was attending to this talk. This talk will be, it was recorded and it will be in YouTube for future viewing. Thank you so much. Hope all of you have a good afternoon, and NEP will continue for the next few days.
Thank you.
Thank you. This was marvelous. Learned so much. Thank you very much.
Thank you.
Wow. It was a pleasure.